Hello again. It is now time to review danger exercises. For people who have a history of back pain and sciatica, we want to divide our exercises into safer exercises and danger exercises. Let's do a standing curl, okay? Okay, bend forward please and pick up the weights. All right. Now, go ahead, come up. Now just do curls for your biceps. All right. It looks innocuous. It looks there's no problem there whatsoever. He's got good form. Very good form. He's standing erect. He's not cheating. He's not bending forward. But what is he doing? Okay. In doing the curls in that way, he did work effectively his biceps, but number one, he had to pick up the weight, which created, he had to go through flexion. If you remember, flexion is going to greatly increase the pressure within the disc. He had to pick it back up, and now he's standing and he's loading the spine. Remember the four danger actions are loading, flexing, extending, and twisting. Okay, so now in picking the weight up, he had to flex forward, creating increased disc pressure. Now he's standing, he's holding the weights, even if he did nothing. Go ahead, pick up the weight, Chris. Now just holding the weights at his side is loading. He's loading his body with 20 extra pounds. And what loading is going to do is compress the disc. The disc is going to be compressed, and if you can put that down if you would please. So what are the dangers there with a compressed disc? If you compress the disc, then the hole that the nerve goes through becomes smaller. You can compress and hit this nerve, and you get increased sciatica if you have a propensity for sciatica. If you have a facet syndrome like this, then you're putting more weight on the facet joint, and the facet joint can hurt. You can have aching in the back. So that's the danger of doing something which looks fairly safe, but it really isn't safe. Curls work the front of the arms called the biceps. So in this position, as you can see, he can curl the dumbbells up to the point where he doesn't have any tension. Both of them at the same time. Curl, bring them down. Curl, bring them down. And you do 12 to 15 repetitions of a curl. Now, when I do these exercises, what I do is I do a set of presses, and then I do a set of curls. Then I go back and do another set of presses, and then I go and do the curls, so that while you're doing the curls, the muscles you use for the presses are recovering. And while you're doing the presses, the muscles you do for the curls are recovering. So you can alternate between the two of them.